on the zygomatic bone, and slightly below the li point, this is the extra foot point, just below the li point on zygomatic bone, in front of the concha, this antitragus area, you see, in front of this is the extra foot point. All type of foot problems, plantar fasciitis and foot pain, heel pain, ankle pain, then you have to use this point. If there is pain in dorsal side, then you have to put needle like this. For knee pain also, you can use this point for knee pain. When you have front side knee pain, then you have to put needle like this. And when you have pain from popliteal fossa, then you have to needle like this from back side. Same when you have a problem on dorsal foot, then you have to put needle from front side. Otherwise, you have to put needle on back side for plantar pain. For heel pain, you can put needle from both sides like this. And if there is pain on the knee, on medial side and on lateral side and on front side, then you put 2 needles like this. It is very useful point for all type of knee pain. Then there is another second point for extra point. That point is gastrocnemius point, and gastrocnemius point is very near to ear, behind the hairline and in front of the point, knee point. Oh, extra foot point in front of this, it is the point for gastrocnemius. This point is used for calf muscle pains. When there is calf muscle pain, then you can put needle like this, top to bottom and bottom to top. For gastrocnemius muscle pain. After that, we are coming on shoulder point. Then the shoulder extra point is on this mandible bone corner, on black area. Then you have to put needle like this. Palpate on the corner of mandible. Then you put needle here. After that, this point is extra lumbar point. It is the midway of the mandible bone, and there is a notch. Okay, it is used for all type of lumbar region pain. It is extra point, and you have to needle like this, and you can use needle like this, anterior to posterior like this, and you can put needle like this. Slightly half tune needle, 13 into 25. Okay. These 4 points are extra point. First is for extra foot point, then gastrocnemius point, then shoulder point, then extra lumbar point. these 4 points bilateral on the same side, on another side also. Okay.
Please repeat
Now,
the extra 4 points, please, Prof. Sir.
yes.
Can you because I repeat the extra 4 points?
Okay. I repeat. With needling session, the first point on the on zygomatic bone, this is extra foot point. When there is any problem in knee pain on lateral side or medial side or back side or front side, then you have to needle like this. If there is pain on both sides, then you have to put needle on from both sides like this. If you have problem from lateral side or front side, then you have to put needle from front to back. It is clear to you or not? Visible?
Yes.
Okay. Then
Not
for
really clear,
plantar
sir.
fasciitis or any problem in dorsal foot or plantar foot, then you have to needle. For plantar foot, you have to needle from this side, and you can put needle from bottom to top, no problem. But for dorsal problem, you have to put needle from front side. Okay. Then next point is in front of the same point, that is gastrocnemius point. You have to put needle on this point like this for gastrocnemius muscles. Gastrocnemius muscle is, you know, the calf muscle. Okay. Then third point is this black point. It is on the corner of mandible bone, and it is extra shoulder point. It is used for all type of shoulder pain, then upper arm pain. Okay. You have to put needle like this below the bone or most sensitive area. Then fourth point is this point, lumbar, extra lumbar point. Then for all type of lumbar region problems and lumbar pain, you have to put needle like this from front to back and from lateral to medial side. Most tenderful point you have to target. Now it's clear to everyone.
Yes, Prof. Sir. Thank you.
Okay. Now, if you have any question, then please ask. About 4 points.
Good evening, sir.
Good evening.
There is where that foot point, there's a vein, like in my face, there's a vein that crosses across that area. By needling it, I hope we will not puncture it, so to speak.
About this needle?
Yes. Around that area, I think there's one vein that goes to the head from that area. So I hope it will not puncture it if we try to needle that foot point. That's just my fear.
No, there is no need of fearing because there is not any nerve. It is not a nerve area. And here is also, there is no nerve.
Okay.
And it is very near to bone. and bone treats the kidney. So it is very useful for all type of problems. Because when you put a needle near the bone, then it regulates the kidney. It is the law of Professor Tung. They always tell bone treats the bone and bone treats the kidney. When there is inflammation, then put near a needle near to bone on digital area. You know the main basic of Tung acupuncture, bone treats the bone and bone treats the kidney. Lung treats the skin and skin treats the skin. Okay. Muscle treats the muscles and muscle treats the stomach. Then next is spleen, vein treats the vein and vein treats the heart. Like this. So we are going for this wonderful YNSA. Then today we are going for young points. Now it is very clear to everyone.
I want to ask you a question.
Yes.
Yeah, that foot area, I mean, the point at the mandible area, I
Yes,
understand it is a local point for toothache. Can those points also work for toothache?
Please repeat your question.
I said the extra point at the mandible area.
Yes.
So I can see they are at the local point for toothache. Can they also work for toothache?
Yes, yes.
Pain. Okay.
Yes. It can work on tooth pain because it is local area.
Hello,
Thank you, sir.
Now,
hello, Prof.
yes.
Yeah. That the foot, the extra foot point, is it not very close to the large intestine?
It is very
I don't,
near.
they on the
It is
same
very near
point,
to large intestine
but not the same
because it
point.
is on zygomatic bone, and large intestine point is just above the zygomatic bone.
Okay.
Sure. So, shall we start for young points, basic young points?
Okay. Prof,
Okay.
Prof, just a moment. Let me stop the video so that I start the young points afresh. Just a moment, sir. Let me stop the recording, I mean.
Okay.